Have you ever wondered why diabetes occurs? It's a question that's crossed many minds. In order to understand this, we first need to know what diabetes is. It's a chronic disease that affects how your body turns food into energy. There are three main types: type 1, type 2, and gestational diabetes, each with its own specific characteristics and causes. Type 1 diabetes is an autoimmune condition where the body's immune system attacks and destroys the insulin-producing cells in the pancreas. Type 2 diabetes, on the other hand, is a condition where the body either doesn't produce enough insulin or it can't use it effectively. And then there's gestational diabetes, which occurs in some women during pregnancy. This video will focus on the biological process that leads to diabetes, trying to answer the question, why does this disease occur? We'll explore the role of glucose, insulin, and how lifestyle factors can influence their interaction. So, why does diabetes occur? Let's delve into the biology of it. To understand diabetes, we first need to understand glucose and insulin. Let's start with glucose. Glucose is a type of sugar that our bodies use as a primary source of energy. It's like the fuel for our cells. So where does this glucose come from? Well, it's derived from the foods we eat, particularly those rich in carbohydrates like bread, pasta, and fruits. When we consume these foods, our digestive system breaks them down into their simplest form, which is glucose. This glucose then enters our bloodstream, ready to be transported to the cells throughout our body. But glucose can't just enter our cells on its own. That's where insulin comes into play. Insulin is a hormone produced by an organ in our body called the pancreas. Think of insulin as a key. Our cells have doors, and these doors are locked. The insulin, or the key, unlocks these doors, allowing glucose to enter and be used for energy. Without insulin, glucose would just stay in our bloodstream, unable to provide the energy our cells need to function. This function of insulin ensures that our body gets the right amount of glucose it needs. When we haven't eaten in a while, the pancreas produces less insulin, and when we eat, it produces more. This balance ensures that our blood glucose levels stay within a healthy range. However, it's not just about getting energy. The process also ensures that our blood glucose levels don't get too high. When there's too much glucose in our blood, it can lead to health problems, which we'll discuss in a later scene. So, glucose and insulin have a critical relationship in our body. They work in harmony to ensure that our cells get the energy they need when they need it, and that our blood glucose levels stay balanced. But what happens when this relationship gets disrupted? That's when diabetes comes into the picture. So, what exactly goes wrong in our body that leads to diabetes? It's a great question, and to understand the answer, we need to delve into the two main types of diabetes, type 1 and type 2. In type 1 diabetes, a bit of a civil war erupts inside our bodies. Our own immune system, the very defense mechanism that's supposed to protect us, turns against us. It launches an attack on the insulin-producing cells nestled inside our pancreas, obliterating them. With these cells gone, there's no one left to produce insulin. It's as if the factories responsible for manufacturing this vital hormone have been shut down, leaving us in a state of insulin deficiency. This is the harsh reality of type 1 diabetes, a case of mistaken identity where our immune system confuses friend for foe. Now, let us shift gears and turn our attention to type 2 diabetes. Here it's not so much about destruction, but more about resistance. Imagine insulin as a key and our body's cells as doors. Under normal circumstances, insulin unlocks these doors, allowing glucose to enter and fuel our cells. But in type 2 diabetes, the locks on these doors become rusty and stiff. They resist the insulin key, making it harder and harder for glucose to enter. As a result, glucose accumulates in our bloodstream, building up like rush hour traffic on a Monday morning. This is insulin resistance, the crux of type 2 diabetes. In both scenarios, whether it's an immune system gone rogue in type 1 or stubborn cells in type 2, the outcome is a surplus of sugar coursing through our veins. Whether it's an attack from our own body or a rebellion by our cells, the result is the same, an excess of sugar in our blood. But why is this a problem? Well, we'll delve into the impact of high blood sugar in our next segment. Stay tuned. Why is high blood sugar or hyperglycemia a concern? you may ask? Well, let's dive into the world of our bodies and understand the intricate balance that keeps us healthy. High blood sugar, when it goes unchecked, can lead to a series of complications. Imagine your blood vessels as a network of highways facilitating the smooth transport of nutrients and oxygen to your body's every corner. Now imagine if these highways were under constant attack. That's what high blood sugar does. It damages blood vessels, slowing down and even disrupting the transport system, but it doesn't stop there. High blood sugar also wreaks havoc on your nerves, interfering with their ability to send signals. It's like a phone line with static, making communication difficult. This nerve damage, called neuropathy, can lead to numbness, pain and weakness, especially in the hands and feet. And then there are your organs, your body's powerhouses. High blood sugar can damage these vital parts of your body, leading to a host of problems. The heart, for instance, can be affected, increasing the risk of heart disease. The kidneys, which filter waste from your blood, can also take a hit, potentially leading to kidney damage. Now let's talk about your eyes. High blood sugar is a leading cause of vision loss. The tiny blood vessels in your eyes can be damaged, leading to conditions like diabetic retinopathy, which can cause blindness if not treated. And remember, these are just the physical impacts. High blood sugar can also lead to fatigue, frequent urination, and extreme thirst. It may even cause you to lose weight without trying. These symptoms can be a real detriment to your quality of life. So, it's clear that high blood sugar can lead to serious health problems, but can we do anything to prevent or manage diabetes? This is the million-dollar question, and the answer is yes, we can, but it requires understanding, vigilance, and most importantly, action. Stick around, and we'll delve into the ways to prevent and manage diabetes in our next segment. Can we prevent or manage diabetes? The answer is yes. It may seem a daunting task, but with the right lifestyle changes, it is within our reach. Let's start with exercise. Regular physical activity has an array of benefits. It helps control weight, uses up glucose as energy, and makes cells more responsive to insulin. So whether it's a brisk walk, a swim, or a game of soccer, find an activity you enjoy and make it part of your routine. Next, we have diet. A healthy diet is key in managing blood sugar levels. Opt for foods low in saturated and trans fats, cholesterol, and high in fiber. Fruits, vegetables, whole grains, and legumes should be staples in your meals. And remember, moderation is crucial. Even the healthiest food can lead to weight gain and high blood sugar if eaten in excess. Speaking of weight, maintaining a healthy weight is another critical factor. Being overweight increases the risk of type 2 diabetes. So it's essential to keep your weight in check. If you're overweight, even a small amount of weight loss can help prevent or delay diabetes. Regular checkups are also a must. They allow for early detection and management of high blood sugar levels, so make sure you're keeping up with your doctor's appointments. But what if lifestyle changes aren't enough? Sometimes medication or insulin therapy might be necessary. These treatments help your body use insulin more effectively or make more insulin. It's important to remember that these aren't substitutes for healthy lifestyle changes, but rather they complement them. Remember, knowledge is power. Understanding why diabetes occurs is the first step towards prevention and management. Take care of your body, and it will take care of you. So let's put this knowledge into action and take steps towards a healthier future. After all, our bodies are the only place we have to live in. Let's make sure we're taking good care of them. So there we have it, the biological process that leads to diabetes. We've explored how our bodies use glucose and insulin, and how an imbalance can lead to the onset of diabetes. We've shed light on the consequences of high blood sugar, which underscores the importance of maintaining a healthy lifestyle to prevent or manage this condition. Remember, knowledge is power. Understanding the intricacies of diabetes helps us make informed decisions about our health. If you're experiencing symptoms or have concerns about diabetes, please don't hesitate to seek medical advice. Early detection and management can significantly improve your quality of life. This journey into the world of diabetes is just the beginning. There's so much more to learn about our bodies and how we can nourish and protect them. Stay informed, stay healthy. Thank you for watching, and remember to subscribe for more informative videos like this one.